This conference will now be recorded.
Okay, good morning. Right, I hope you all can listen me now. There is some issues with, I don't know, the new sessions which I particularly book. These ones, they do have some problem. Audio becomes disconnected in those. But anyway, this is our recurring session. We can always join this one. Okay, so we will continue with labor management and postnatal care. So the people who couldn't do yesterday, I will start from them. Dr. Rehab, are you okay to do the first one? Because you were not able to do one yesterday.
Hello,
okay.
ma'am.
Yes.
Ma'am, if it's okay for Rehab, can I do the first one? Because I've asked my husband to look after my son for just 10-15 minutes so that I can present easily. Then I'll take
No
care of my son.
Okay.
Okay, thank you, Rehab.
Thank you.
Okay, thank you.
All right.
Yeah,
Okay.
I'm fine.
Okay, Sundar. So there you go, your first scenario. Let me just say. All right. Okay, so this is your scenario then. Okay, that's your first 2 minutes.
Yes. Hello, my name is Dr. Sundas, one of the doctors in the postnatal ward. And you are Maria Smith.
Yes, doctor. My name is Maria Smith.
So, Maria, how are you doing right now?
Well, I'm pretty angry and very upset because of what you have done to my baby. I mean, it's really, you know, I'm absolutely furious to see. I mean, how can you mismanage like this? When I see my baby, you know, I was so excited to have the baby, and now when I see my baby, my heart really sinks. You know, there are so many bruises on my baby's face, and then there is a big cut on the baby's right cheek. And I don't know whether because of that gut an infection, what's going on. My baby's not feeling well. And I'm told he probably has a jaundice as well. And the baby has ended up in special care unit. So, I mean, how can you do that? I mean, how can you cut through the baby's cheek? I just can't believe.
First of all, Maria, I want to apologize. I'm sorry that it happened to you and your baby. And for that, I'm really sorry.
Well, that's not going to help, doctor, is it?
Yes, I understand you are very angry, and it's totally understandable because of the circumstances you are angry. But I'll try my best to answer all your concerns and to also arrange a meeting with the baby doctor so that I can see that you are very anxious about the baby also, and that's very understandable. So I just want that's all I can do for you. I'm here.
I want to sue the trust, doctor. I'm going to sue you. I don't think you are very well trained actually to do these operations and these forceps deliveries.
So Maria, it's okay if whatever action you want to take, it's you're right and you can do that. But if you want, I will tell you from my side that what actually happened, and later on, if you still want to file an inquiry or the complaint, that I'll really facilitate you for that also. How do you feel about it?
Yeah, okay, go on. Say what you got to say.
So, Maria, first of all, I want to know that you delivered 3 days ago. So, how are you doing right now? Have you opened your bowels and are you able to urinate?
Yeah, I have. I'm okay. I'm just worried about the baby.
And have you seen baby yourself? And you have talked to baby doctor so far?
Yeah, I have. I went to the baby unit and I've seen the baby, and that's why I'm so upset.
And were you able to talk to the baby doctor as well?
Yes, I did talk to them. Yes.
And what they told you, Maria?
So yeah, they just told me, they're keeping the baby under observation, and the baby might be developing some jaundice as well.
So I can see that baby has some feeding difficulty. So are you able to breastfeed him till now, or you just not able to start feeding right now?
I have expressed milk to be given to the baby,
Okay,
but I'm told the baby is having some difficulty in, having the feed as well.
Okay. And what about any pain in your stitches?
No, it's not better. I have the pain relief, so I'm doing okay.
And you're up and about? Any problem in moving around?
No, I have been up and about.
Okay, so Maria, first of all, I again want to apologize for all that happened. Regarding your care, I'm sorry that it didn't meet your expectations. However, you were given the trial of labor. And then you were I was there, and you can see that we tried our best to deliver you vaginally normally. And however, sometimes when it's not beyond the time that we can actually wait, and baby waiting for a long time can put baby at more risk. So I did the forceps delivery.
Okay. Yeah.
And keeping in mind with the forceps delivery, we can give a try of forceps delivery with all the preparations for the cesarean section, because in some cases, forceps delivery, if it's not successful, we cannot wait for long. because we have already waited for your labor to progress, and then we were started the forceps delivery to assist you actually in the normal labor. However, sometimes if it's not possible or if it's unsuccessful due to some of the reason, some or the other reason, then we have to go for the cesarean section. Like throughout you were being told or any complaint during that process, you think you were not well informed during all this labor and then forceps delivery and the cesarean section. How do you feel? Were not satisfied during, by this decision also?
Well, it's not about why you did it. I know I was told, and the baby needed to be delivered. The baby's head was not coming down, or
Yes.
whatever. But it's about like you were not able to, do this delivery in the right way. Should have been done. And if you were not able to do it, I mean, you should have called some more senior doctor who are trained to do these deliveries. I mean, look, if you just go and look at my baby, you have like the forceps marks on the baby's cheeks, and there are so many bruises, and then there's a long, horrible tear. There is a cut on my baby's face, so my baby is gonna live with that scar on the face. And now my baby
Maria, I can see that. Yes, I can see that you are very concerned and it's very valid. However, whenever we are doing these deliveries and cesareans, we have met the competency to do it. However, these are the known complications that could have occurred, and that are actually very rare, unlikely to occur. But in emergency cesarean like your baby have, there's slightly more chances of these happening. But still, I'm really sorry that it has happened to you, and I can understand it must be very terrible for you.
Yeah, I want to sue, doctor. I'm just not satisfied. I'm not satisfied whatever you're telling me. I feel it's totally unacceptable.
Yes, I can understand being a mother if you feel like this. I can arrange an appointment with my consultant also if you want to talk about this with him. And there is a if you're still not satisfied and you want to lodge a complaint, then there is a first of all I'll mark this as an incident report, and then we'll see that what have done and what could have done to prevent it from happening. And once the report will be ready, I'll share it. I myself will make appointment with you to share this. And still, if you want to complain, Maria, then there is a patient advisory liaison services. I can put you in touch with them. You can complain internally also. How do you feel about
Yeah.
it?
Yeah, I'm definitely going to put the complaint. I'm going to sue the trust for this.
Okay. In that case, I'll tell you about the PALS, Patient Advisory Liaison Services also.
Yeah.
Okay, and I can see that this must be very traumatic for you. So if you want to I can put you in touch with the counselors also. Talking to them can be really helpful. How do you feel, Maria, about it?
Well, at the moment,
They
I
can
feel
actually
okay.
tell you
I
how
don't
to.
need to, I don't need to talk to the counselors. I'm really angry. I'm
I can
really.
see this is very understandable. I can see that you are very angry. At any point of time, if you think that you want to talk to the counselors, then these are the 24-hour contact number. You can let us know and we can put you in touch with the counselors. Once again, I'm really sorry what that had happened. But these are the things that we can do for you and to manage from now onwards. And you have talked to the baby doctor. So once the baby is in the special care baby unit, it's just for the precaution that they had kept him, and there's some jaundice, as you know. But once the baby will be fine and will be discharged, then you will be updated that for that also.
Okay. Yeah, that sounds
Any
better.
questions so far?
No, that's okay. Yeah.
Thank you so much.
Okay. So first, well done, Sandhya. You did really, really nicely. About just acknowledging, whatever's happened. And at the same time, not forgetting to establish her immediate well-being because it's only her third post-op day, and also arranging some counseling for her, offer that counseling because that's very important. Regarding a few of the questions she said, I feel you're now well trained. You shouldn't be doing this, and you have done this all. The rest was fine. You did establish the baby. You have seen the baby and all that. So it's not purely a negligence that you have done. We know these are like they are rare. The cut on the baby's skin. But obviously, they are one of the known complications which can happen in these type of circumstances when you have failed the force of delivery and then full dilatation. And then she believes that you actually were not the trained person to do that. So I feel that you need to give a little explanation there as well to try to balance. Yes, don't be defensive here. But we need to give a little balance between to make that, you know, that you have been trained and have been signed and all that, and we are aware of these complications as well. However, because of, you know, the overstretching of the lower part, it goes very thin, and, you know, the baby's head was really down and all that stuff. You need to just give a little balance as well, so that she can understand that it's not like kind of, you know, just some untrained doctor has done it and it's absolutely, you know, a negligence which has been done with her baby. So yes, to start with, it's fine. You'll take the name. I will say make your tone a little bit softer as well here, so that she doesn't take it like we are just just in a professional way, just asking her, right? Okay, if you want to make a complaint, make it. So just appear to be more listening. But at the same time, try to help her to understand as well that this is not because, you know, I'm untrained and I've done some negligence. But anyway, I go through now how to do this. So yes, this woman, you will start with say, hello, Maria Smith. My name is this and this. And I have been asked by the midwife to come down and see you because you have some concerns and you want to talk to me. So you basically here, you can give the chance to her first. So just confirm her name to say, can you just please confirm your name and date of birth? And then give her a chance to talk to you first to say what happened. And she will. In this particular scenario, the role player will start talking straight away anyway to say, I'm furious, I'm angry, that's what you have done to my baby. And at that time, just really stay quiet and let her talk what she wants to do. Don't appear like you want to start talking, because that is seen then as a defensive behavior. So let her complete what she says, and then you need to start in a very calmer way to say, I can see you're very angry and upset, and I fully understand that. So instead of saying it's understandable, because it's more to you, you know, whatever you have done. So it's a kind of your reflection as well. So instead of using generalized word, the word that it is understandable, the appropriate word to say is that, and I fully understand this, that it is, you know, quite upsetting. And this is, you know, the cut on the baby's cheek is something which obviously is quite unexpected and upsetting for me as well as a surgeon. Okay. However, in all this, so first you have now acknowledged, and you have also said that you're not only sorry, but that's upsetting for you as well as a surgeon. And then you will say, however, I will actually give the explanation first before I establish her immediate well-being and all that stuff, because that's her immediate concern and she's very furious. So I will continue with that, and I will say, however, as you know, as you understand, the baby, you know, you can just imagine the baby was not, you know, coming down, and the baby's heartbeat was getting upset as well. So it has become really important in the video with this baby. And when the baby's head is high, then applying the forceps and delivering the baby with the forceps, you know, may be unsuccessful. And I discussed with you and explained you know, that possibility as well. And that was the reason that I tried to deliver the baby in the theater. And now when we apply the forceps, and then you can just actually try to tell her with the help of picture as well, by saying, because the baby has occupied all the, you know, this area, and then we have to, and you know, the bony part of and this your vagina basically can shake, you know, has only some limited space. So when we apply the forceps, they need some extra space as well in there, and then we have to lock and then help the baby to pull down when you are pushing. So in this circumstance, it is not unusual that there can be some mark and bruises on baby's face or even on the head. And you can see, because it only says the bruises, you can say I have gone. So you need to say as well, you've been following the baby. I have gone to see the baby and I've spoken to the baby doctors as well. There is no signs of infection in those bruises or in that cut which has happened on the baby's face. So I'm hopeful they will heal, nicely without causing any further problems to the well-being of the baby. Regarding that cut, after the failure of the forceps delivery, then we decided to go ahead with to deliver the baby with the cesarean section. Now, in these cesareans, when you're already fully dilated, what happens with the womb, and you can actually make that picture to say that because of the continuous process of the labor and opening, there needs to be the opening of the neck of the womb. As a result, this part of the womb become really stretched to try to open and give the space to the baby to be delivered. And as a result, it become very stretched and quite delicate and thin as well. Okay, so this is one of expected complications. We are aware of these complications, and I did take our appropriate measures to try to avoid. However, because the baby's head was really tightly, fixed in that part, there has been that abrasion and that cut on the baby's skin, which I'm extremely sorry and upset as well. And then you can say, obviously, we are taking, I have spoken to the baby doctors, we are taking our appropriate measures to make sure that no infection happens in that, right? I'm hopeful because it doesn't tell us the depth of the cut or anything like that. Then you can say I'm hopeful that this small cut this will heal without leaving much scarring behind, as most of them do heal without any marking and scarring. However, it will be too early for me to say that whether there will be any scar left or how that will go. So we will be keeping an eye on that as well, and we will try to provide you all possible support as well. I fully understand it's not what you are expecting, and seeing the baby with all these bruises and the cut on the cheek is quite upsetting and kind of a painful experience as well, as a mother for you and as a surgeon for me as well. So then you can feel like, I can see you're angry. However, if you don't mind, I would also like to ask you how you are coping with this, emotionally. So let her say that as well. Yeah. So this is how you will approach her depression, and if she's feeling low because of it and what is going on. And then whatever she says, obviously she will be angry and all that stuff. And then you can say, if you feel it may be helpful, I can arrange one of our counselors to come and talk to you as well. And I will ask the baby doctors to come down and see you again and explain. And then you can start her immediate well-being to say, so because it's only third day of your cesarean section, please tell me how you're doing and how is your pain? Is it quite under controllable? Have you opened your bowels? Are you able to eat and drink? And then, yes, have you gone around to see the baby? And has you been able to speak to the baby doctors? And then say, reassure as well that I will make sure that I request one of them to come down and update you with the baby's this particular process of healing as well. Regarding feeding and jaundice, now you need to address that as well. And then you can say regarding the jaundice, the babies can have some changes in their blood immediately after the birth, and as a result, they can have the jaundice. So it's not fully developed jaundice anyway, but we are aware of this as well, and the baby doctors as well. That will be dealt appropriately. And the keeping eye on the baby's feeding as well. Okay, so that just is precautionary, because it says precautionary. You can say that this is precautionary, the baby is okay. I mean, we could leave the baby with you as well, but it's just like precaution and the further safety, just to make sure the baby is closely observed and monitored over there. And that will help also to prevent any infection or anything in the baby as well. Okay. So this is what we'll address for that, and then you can say, you know, so is your partner here, and has your partner been able to see the baby? And then you can just offer. But then regarding her complaint and stuff, don't put this as a stages to say that, you know, I will do this first and then do this, and if you're still not satisfied, no, just simply say, I have reported this as an incidence, and what happened in these circumstances, then we do a detailed analysis. So it will be, you know, analyzed, and to see if there was anything different I could have done to prevent it from happening. You know, so just say, although it's known, one of the known complications of this type of cesarean, but still we're going to do that and see if there is anything different I could have done to prevent it from happening. So I will update you with those details as well. However, if you feel that you would like to put a complaint as well to have a more detailed inquiry, it's absolutely okay. And what I'm going to do after this discussion, I will provide you the details of the whole process, how to put the complaint, and also the contact details, so that you can send them the link about their department, your complaint. So and obviously give you the details of the process as well. Okay. Regarding if she says, no, I don't know basically the details of the, if she says, you know, as I said, like you're not trained and you're, because this is usually happens, when this type of, they say like you're not trained and all that stuff, then you can say, regarding your concern that I probably was not trained to do this type of deliveries, I want to reassure you that there is a, you know, a very structured program of our training. We get appropriate training, and we get assessed many times before we are actually signed off to be able to perform certain procedures that we are competent to say that, yeah. And then you can say, I have done many of these similar procedures till so far without much of the complications at all, you know, some without any complications. But then, as I explained to you, these are unfortunately one of the known complications, and they can happen. They can happen even in very experienced senior consultants' hands as well. However, and then at the same time, again, immediately after that, again say, however, I fully understand, you know, your concerns and your you being so unsatisfied from this. Okay. Right. Any questions?
Yes, doctor. If she told that the jaundice because of your bad manipulation, what we will tell her?
So for the jaundice, because it just says, and the scenario doesn't say the baby there was a bleeding or stuff. Though unless obviously there has been some severe problems from that point of view, hemorrhage and stuff or anything. Obviously jaundice is not. So that's why we have explained how to say that the jaundice is not uncommon, and some babies, most of the babies can have it, and that's because after birth there are some changes in the blood of the baby. So you know, it recovers itself as well. So that's why we are keeping close eye on the baby. So obviously jaundice is not because of that. Feeding difficulty could be because if there are bruises and if there is that cut, then baby may not be able to suck very nicely. But you know, you can say, you know, it's just the precaution.
Okay. And
Okay.
if she, I will tell her about the complaint. After she told me I want to complain, or in the same phrase like you told, I will incidence this report. I will report this incidence. However, if you want to complain, I will offer her to complain, or she is after she told I want to complain.
If she says, so we don't offer ourselves to say that you can also complain about this. No, if she is not saying I want to you know, put a complaint against you and I want to sue the trust, then you don't need to offer it. Just all you need to then reassure how we get, you know, assessed and trained, and then also about like, you know, we although it's one of the known complications, still I have reported this as an incidence, and then we're going to have a detailed analysis and blah blah. But if she's saying at the same time as well that I want to complain, which usually is the case, you know, it's very unlikely that with these type of complications, they don't say we want to complain. So then you can say, you know, however, if you want to put a complaint as well, that's absolutely okay. and I will give you that information and all the about the process and the contact details to facilitate you to put the complaint.
Okay.
Okay.
Thank you very much.
Dr. Sophia?
Yes.
Hello. In such cases, usually we should go and apologize before she'll ask to see me, isn't it? Or I wait till she asks?
No, you go and start the process as open. So as sir, like I will go in and say, well, hello, Maria Smith, my name is Dr. This and this.
No, I mean duty of candor. Next day, immediately I should go and apologize and explain, isn't it?
Yes, well, that's supposed to be. That's what not the next day. Immediately after the birth, as soon as she comes, you are basically supposed to go on and explain her everything, what has happened, and what you have done about it. So here, obviously, that probably has happened, but obviously, still with the time, they do feel angry, and then they want to see you again, because at that time, obviously, she has the cesarean, she hasn't actually seen the baby properly, what exactly has happened, and all that stuff. So she may not take it. So you don't worry about the duty of candor here. That yes, but otherwise, for your learning purposes, yes, you always must go straight away and speak to the patient.
And I need to tell her that already before I took the consent, I explained to you that this might happen and this might happen like this.
I wouldn't go into the detail by saying that I had done this with you.
Suppose that she was very angry, not accepting.
That become, defensive. But what we have said when you will listen this recording again, we have said to her by saying that as we discussed with you, these are these complications can happen. We are aware of these complications; they can happen. And I try to take all possible measures I could to prevent it from happening. However, sometimes it just become unavoidable. And that's why you explained as well, like, because that stretching, the tissue is so thin, when you try to open, that has left some small cut, a superficial cut in the baby's cheek as well. Okay.
Dr. Sophia, suppose that I know this patient, how I will go and tell her this is Maria Smith and I am the one delivering her and she knows me. So how is the entrance?
Yeah, so she knows you. The scenario says you deliver the baby and she wants to see you.
Yeah. So when I enter the cubicle, what I
you
will
will
tell?
still do the same. You will still do the same. Hello, Maria Smith. My name is this and this. And then you will say, can I just, confirm your name? Because since 3 days, you have seen so many other patients as well. She remember you. You might have not exactly by face remembered her. And it's not about remembering. It's about like to confirm the ID of the patient anyway. So you will do that. And then you will say, you will just open, you will put the beginning in a very open style to say, I have been asked by the midwife to come and talk to you because you want to discuss, few things, and you're very concerned about some matters. So would you please, let me know what you are. So what are you worried about? And then obviously she will start. Okay. Right then.
Dr. Sophia,
Yes.
hello. Dr. Sophia, I
Yes.
just want to ask one question, not related to this this scenario, but I just want to ask that how in the exam that, as the guideline doesn't say that which instrument we are going to apply, they said on the experience of the clinician. So how we will decide on the exam that we are going to apply this specific instrument, either forceps or either like any specific position or any station like vacuum, and because it's quite confusing that which instrument we need to use.
So if you read the guideline of instrumental delivery, that just says they have tell you the prerequisites. So if the prerequisites are met, then actually it's absolutely your choice as well. And you're fine to say, if you like to, that I'm going to apply the vacuum. And then you can tell the reasons, again, same, which are given in the guideline. You can say it doesn't, take the extra space and the risk after the baby's face and those areas come. However, this is, but you can do the rotation with the vacuum as well as with the forceps both. So and the prerequisites for the application of both are same. So obviously, if you have decided to apply the instrument, that means it's fine basically to apply any of those. And when it says it's up to the expertise and the confidence of the operator, then that means this is up to your choice. So you're fine to choose any one of those. as long as you do know them. Just like, read the guideline again, where it states, basically tells you the difference between, the vacuum have these benefits over forceps, and the forceps have these benefits over the vacuum. But otherwise, it's fine. You can choose any of them, and you can say this you will do.
Okay, thank you.
Okay.
Ma'am, I have a question. In this scenario, I was assuming that why the forceps delivery was failed and what actually happened, because I know that at this point of time, if I'll ask her, then she will say that
No, you
you
don't
were
need
the
to
one.
ask it. You don't need to
In this
ask.
scenario, I'll have the details, basically, what actually happened, why forceps hold the delivery
They may not.
nose.
Right. There may not be any details given, and that doesn't matter. That's not going to change any outcome or your focus of discussion, because the focus of discussion now is whatever happened, whatever the reason was, and her concern is not that either, that why you applied it, you could wait longer and things like that. Yeah. So that's not a problem. So till now you will assume you applied it for right reasons, and you have discussed that as well, because she's not saying you didn't tell me beforehand, right? She's not saying that either. So you're fine to assume that you have discussed these risks as well before the surgery. So you don't need to worry about it. All you need to say is that we discussed with you before the surgery, that these are few, the complications which can happen. These are few complications which can happen when we do the cesarean section under such circumstances. And I was aware, this is another thing you need to say, I was aware of that, because if you discuss that, that means you are taking measures as well. And I try my best, I try my maximum best to prevent that from happening. However, sometimes, again, don't say it was unavoidable, just say sometimes it just become unavoidable. And I'm really, sorry and upset as well that this happened. Okay. Okay, so let's go to the next scenario. So, Dr. Rehab, next one is for you. Okay, this is for you.
Hello,
Yeah.
hello, Dr. Sophia. I'm in the labor room. I'm a
Okay.
bit busy.
All
After
right.
a while, yeah.
That's fine. No
Just then
worries at
call me.
all.
Okay.
No problem. No problem.
Okay, thank you.
So, Birjay, this one is for you then. Hello.
Dr. Sophia, Dr. Bridgie messaged that she's unable to take in the group
She's
she
not there.
messaged.
Okay, Mehreen, that's for you then.
Okay, Dr. Sophia.
I'm sorry.
Can I start, Dr. Cecily?
Yes, if you're ready, it's fine. Yeah.
Okay. Hello, is this Mrs. Jason?
Yes, hello, doctor. Yes, my name
I'm
is.
Dr. Marine.
Yeah.
All right. I'm Dr. Marine, one of the doctor in the accident and emergency. So, can I call you Jason?
You can call me Mrs. Jason, doctor.
All right, so Jason, I'm asked to see you because I come to know that you have cesarean section 2 weeks ago and now you have some difficulty in breathing and swelling in the leg. Is that right?
Yes, doctor. I started having this pain and swelling in my leg last night, but since morning I'm really struggling to breathe as well.
So how are you? Are you still finding difficulty?
Yes, I'm finding really difficult to breathe. Yes.
So do you want me to call my nurse to give you oxygen? So it will help you in breathing.
Okay. Yes, whatever, doctor. Yeah. It's
All
really
right, all
difficult
right,
for me to breathe.
all right. All right. So can I talk with you? If you are feeling better?
Yeah. Okay.
All right. So tell me, Jason, that tell me. So how is your how was your deliveries? That is it fine? Like, is there any complication in your cesarean section?
No, I didn't have any problems. I was not told there were any problems, and I went
Okay.
home on third day,
Oh,
and I was okay. Yeah.
okay. And how is the baby?
The baby is doing fine. Yeah.
Are you breastfeeding your baby?
Yes, I have been breastfeeding. Yeah.
All right. And tell me, Jason, that have you given any, any blood thinning agent in the pregnancy or after the delivery of the baby?
I didn't have anything in pregnancy, but I had that injection in my skin when I was at the hospital for 2 days.
And after that?
No, I didn't have anything after that.
All right. All right. So what about are you well have you taken fluid regularly, and what about you mobilize yourself?
Yes, I've been up and about as much as I could do, but I still feel pain in my scar. Um, I'm tired most of the time as well because baby's not sleeping quite well.
All right, all right. Jason, from your as you are feeling, for how long you have feeling that pain in your leg?
I started feeling that pain and swelling yesterday, but this breathing has become difficult this morning.
All right. So, Julie, Jason, what we are going to do, we are going to admit you in the hospital. As from your history, it seems like that there
Okay,
is a
yeah.
very high suspicions that with cesarean, as you have the cesarean section and your BMI was on the slightly higher side, and you not mobilize as much, so due to your pain, so it seems like that there may be in the pregnant in the after the pregnancy, after the delivery of the baby, there may be a risk that there's a thickening of the blood. Okay, and it may lead to the formation of the blood clot, which can leads to a serious complication. So we have a very high suspicious for that. So what for this, what we are going to do, we're going to admit you. One of my staff nurse is going to put a cap in your finger, so we will see your oxygen levels and oxygen levels, and and at the meantime she will put an IV line in your hand, and we will take your blood we will take your blood to see about if there is any that what are the blood levels, and we have to see the salt level, your kidney and the function how your kidneys and the liver functions. We also need to do your a chest x-ray. All right, and we will also do a strip of your heart. We call it as ECG. I will also inform also inform your case with my consultant, anesthesia doctor, and the blood doctor. All right, and a radiologist as well. So as your legs as your legs are you said that they are swelled, I will examine you in a while, and then we may need an urgent special scan. We call it as Doppler scan of your legs as well. All right.
Yeah, I think you're right.
Mhm.
I may have developed that clot because I did have
Hmm.
clot in my leg after my last birth as well,
All
delivery.
right. All right, all right. Okay. So I will also discuss your case with the blood doctor, and we will start you a blood thinning agent. All right.
Yeah, okay.
Okay,
Yeah.
and my staff, and you will find a lot of people around me, but they are just here to help me out. Okay, so don't get scared, Jason.
Yeah, that's
And
fine.
all right, and uh, Jason, my nurse is just going to give you some some fluids from the drip line as well.
Okay.
Okay, so once we are confirmed that you have that the blood there's blood clot formation in your blood, then we have to give you this blood thinning agent for for a longer time. Um, Once you are stable in that of the hospital, then we have to
Okay.
shift it into either oral or then that of the injection form, because that with this blood thinning agents, it prevents the formation of the clots in the blood. At the same time, it increases the risk of that of the bleeding as well. So we have to balance this both.
Okay.
All right. Jason, I just want to ask that as you told me that you don't have the blood thinning agent in the pregnancy, and only on the day of your operation, not after that. So I need to I need to dig out. I need to see that why this so happened. As you also told me that you have an history of that blood clot formation as well.
Yeah, I did after my previous
Hmm.
delivery as well. Yeah.
All right, I will report this as an incident that why this happened and what we can do to prevent this in future, because you had the risk factor, you should be given the blood thinning agent, so we can prevent this.
Okay. So it means your team has, did some negligence and they have made a mistake not putting me on the blood thinning medication while sending home.
Actually, Jason, it can we have to see that why it is misdiagnosed. All right, we have to see that where is the breach in the care of yours. So we have to look that.
Right. Okay.
All right. Any question, Jason?
No, that's all. So I need to get admitted now. You know.
Yes,
That's
you have to admit, and your baby will be with you. All right.
okay.
Okay.
Right.
Any question?
No, not really. It's okay. Yeah.
Okay, so one of my staff nurse will come and she will take your blood, and we will have your ultrasound of your legs and your chest X-ray, ECG. So when all will be done, then we will let you know what is this, that why this happened and what is going on. All right.
Okay. Right.
Okay. Thank you,
Yeah.
Jason.
Thank you, doctor. Okay. Okay. Is that all you done? Yeah.
Yes.
Okay. That's fine. Right. So a few things. Overall was fine. I'm glad you did realize that this is an emergency. You need to, before you go into the details of the history or anything, you need to just talk to about the emergency things to establish first. So yeah, so this is an emergency situation, and yes, it appears like DVT, but it can be pulmonary embolism as well, because she's saying shortness of breath and all this. So this patient can actually collapse anytime. Okay, so we need to basically take it as an emergency to start with and start doing those things, which you did address. You did say about the starting oxygen, but actually you need to straight away basically call for help for your midwives and nurses, and ask them to put the cannula as well, to whiteboard cannulas, and take some bloods, send them off, put on the continuous monitoring. So put pulse oximetry and then put on oxygen. Although she's having difficulty in breathing, but first we need to obviously check her oxygen levels. So you will say, after talking to her, you will say, so when the name is given along with the title, as is this woman's Mrs. Jason, then you don't call it as a Jason. You must call, when the name is given with the title, Mr., Mrs., whatever, then you must always call Mrs. Jason. Okay, because that's our second name. That's not our first name anyway. So it must be Mrs. Jason all the time. So you say, hello, Mrs. Jason, my name is this and this, and I've been asked to come and see you because you're having some difficulty in breathing. And then you can ask her first, would you please just tell me quickly in detail what exactly is happening? So then she tells you, I have this difficulty in breathing, and I've noticed some swelling as well. And then you can just say, so you can say, I can see you have a cesarean section done 2 weeks ago. So with this difficulty of breathing, are you having any chest pain or chest tightness? And after that, because that's very important basic information you need, and then you will say, okay, so now I can see you are struggling quite a lot with your breathing. So I'm going to, and your heartbeat is quite fast as well. So first I need to just make some urgent arrangements to check your oxygen levels in your blood, and if required, then start you on some oxygen. Because it's fine by now from reading the scenario, you are suspecting some blood clot, and then you can say, and because I'm suspecting there could be some blood clot actually in your leg and your lung, so that can result sometime in unconsciousness. So what we're going to do then, I'm going to sort that out first. So we might start you some with IV fluids as well. I'm going to let my consultant know, and the anesthetist as well. And then I will discuss with my our blood doctors, called hematologist as well. Okay, so now you have just said, so I'm going to try this continuous monitoring to check your heartbeat and your blood pressure continuously, and that, and also your oxygen levels, and if they are low, then I will be putting you the oxygen mask to have some oxygen. All right. So after saying that, then you say, okay, so while we have made these arrangements, are making these arrangements, can you give me some details? So tell me when it started. So it started yesterday, and then I started having this bleeding this morning. Now what you need to do is just, you need to keep in mind, because it's fine, you are going to start her on the treatment, but then at the same time, you need to find out any other reason as well, yeah? Is there any sign of infection? And what else is going on? Was she actually have the family history? She herself has a history. What actually is going on? Yeah, so you basically, in simple words, VT risk assessment you're doing here now. So then you need to ask her, like, has she noticed any, so how was her recovery after the operation? How long she stayed in the hospital? When she went home, was she given any blood thinning medication to take with? And then you need to ask her about, you know, how she's up and about and mobile, which you did ask. Have you been drinking enough water and taking, and then exclude any signs of infection. Do you have any chest cough, you know, any cough or any fever? Exclude UTI, so you're having any stinging, burning when you pass urine or any pain in your tummy. And then you can say after this previous, you know, then do just others, you know, so did you have any history of blood clots in your legs and lungs in the past? Yeah, and then she tells you that she has this one, and then you will ask as well, is there any family history of blood clots? Yeah, because these were the risk factors on which basis, if she was high risk, basically we should have sent her on the prophylaxis to home. So that's what's very important. So she does tell you by saying, well, I had this DVT last time as well. That means clearly we have missed that assessment, right? So we have made an error here. So what you need to say then in that case is you to say that instead of saying you should have been given and you know this must have, because what happens if we say that, she's quickly gonna take that as a right, so you guys made an error, okay, I'm gonna sue this and blah blah, which she might do later on when she come to understand. But what you need to at this stage, because we want to acknowledge as well, all you need to say is, okay, so if you have that history this time, and I can see your weight is a bit higher side as well, so you know, according to the assessment, we usually for these patients, we actually continue their blood thinning medication for a few weeks after the delivery. And we do have a proper, you know, system of assessment in place, but it appears like as we have missed something somewhere, and that's why we couldn't start you on this blood thinning medication at the right time and continue, you know, later on as well. However, so what I will do, I will have a good look into your notes as well to find out, to see what went wrong. And then I will report this as the incidents as well, so that we can do a detailed analysis to find out where the things went wrong and why we failed to, you know, keep you on this blood thinning medication while sending you home. However, at this stage, I urgently need to arrange some tests as well. So we're going to take some blood tests to check for your full blood count and, you know, your liver and function, and also clotting and bleeding for any clotting bleeding disorders and the levels in your blood. I'm going to urgently arrange one chest x-ray and a specialized scan of your leg. We call this Doppler. And while we are waiting on these, after discussion with my, you know, urgent discussion with my consultant, and also the doctors and the cord hematologist, I'm actually going to start you on the treatment with blood thinning medication through the drip. And then obviously, depending upon the results, if we are able to exclude that it's not the blood clots, then we can always stop that medication immediately. So are you taking any other medication at the moment? So, and you have any other health conditions, you know, you're looking doctor regular for, because you obviously want to exclude any other risk or contraindications or anything like that. Okay, so this is how you will set up to start with, and then you will say, okay, so after this chest x-ray and the special scan of your leg, depending upon what we're suspecting, if we're suspecting this clot in your lungs, then we may do a special scan of your lungs as well. We called it, you know, a CT scan. That's a special scan in which we actually measure for the blood flow and your breathing and everything. And that will also help us to, you know, decide. However, the treatment is same, whether the clot is in the leg or in the lung. But because of the risk of this blood clot in your lungs, that can obviously lead to collapse and even death of the person. I'm going to admit you on our high dependency unit, so we can actually continuously and closely monitor you till you know, we have the results and your condition is stabilized. So I'm going to make all these arrangements for you. So this obviously we're going to admit you. You may need to stay here for a few days. It depends like how quickly we will be able to achieve those levels of the medicine and be sure that your condition is stabilized. After that, then we will switch that to, you know, we will see what we need to do, send you home with some injections that will be then established after we have done the full assessment. And then you need to ask about them. So how you feel about this? So about your baby, if you are getting admitted, do you have a spot and the plan available to look after your baby? Are you breastfeeding your baby? And if she's doing, then you can say that you can express the breast milk and that can be given to the baby. So just discuss the baby care plan as well at the same time. Who's going to look after the baby? Okay. Yeah. So this is how you will do. Any questions?
Dr. Safia, when we are offering admission to this patient, so we will start the Clexane or the low molecular weight heparin before the investigation.
There is a lot of background noise. Sorry, I haven't been able to understand at all what you're asking.
Okay, Dr. Safia, I'm repeating my question. I said, for this patient where our clinical suspicion of pulmonary embolism or DVT is high, so shall we start the Clexane before the investigations immediately after offering the admission or not?
Yes, yes, this woman will be because she has given the previous history of DVT as well. So we are going to start. And even if there is no previous history, when there is a high suspicion, we start them on the treatment. Because these tests will be done immediately. There will be all, her chest X-ray and D-dimers and her Doppler and everything will be done within next 1 hour time. So
yeah, but we need to start even before sending the patient.
You will start the treatment immediately.
Start the treatment. And would it be a therapeutic dose or it would be a prophylactic dose?
Therapeutic. So we will start on therapeutic dose.
Okay, thank you.
Yeah. Okay. Any other question? And then yes, ECG obviously needs to be done as well.
Dr. Safia, can the baby admitted with her?
So it's not baby won't be admitted. The admission is done only if the baby has the problems, and baby won't be kept with her either. So baby can be brought to her. So when some relative or partner comes in, he can bring the baby. Baby can spend time with the mother when she's stabilized. And if she's breastfeeding, then milk will be expected. But the baby won't be staying overnight and all that stuff because obviously who will look after that baby then? Okay. Okay, so let's go to the next station. Right, okay, so Birji is not able to do that. Mehreen has just synthesis done as well. So Dr. Rehab, are you now okay to do the scenario next one? Because you're the only person left now to do. Hello, Dr. Rehab, are you okay to do the next scenario? Right.
Hello?
Yes?
Yes, Victoria.
Yes? Is it possible for you to do that? Okay, right, that's fine.
Yeah, okay, okay.
Let me just open the slide for you.
Okay.
Okay, that's for you.
Okay.
Okay, shall I start?
Yes, yeah.
Yeah, okay. Hello,
Hello, doctor.
Rebecca Wood.
Yes, hello, doctor. Yes, my name is Rebecca Wood.
Yeah, I'm Dr. Rehab, one of the doctors in the clinic today. I understand that you are 33 years old and you delivered 3 months back. And your GP, he sent you here because you have difficulties in taking your smears. Is that right?
Yes, doctor. Yes, I mean, it's very painful down there. I find it really difficult. So he couldn't pass the speculum in.
Yeah, I'm really sorry that you have passed through this difficult situation. Can I know how are you feeling now? Are you still feeling pain? Do you want painkiller?
No, it's not like the pain all the time. It just is like, you know, when we try to have a sex or, you know, any examination down there, then I feel really, you know, it's difficult and very painful.
Yeah, I'm really sorry for that. So, Rebecca, as I'm first time I'm meeting with you, would be all right if I ask you a few questions to know more about you and your delivery, then we can discuss your management in details.
Yes, doctor, yes.
Okay, can you tell me how are you, how's your delivery? I understand that you delivered with using spoons.
Yes, yeah. So I had, you know, they had to apply the forceps. My labor, you know, the hour was really difficult as well. I mean, I have been in labor for about 17, 18 hours, and they had to do the forceps as well. And then I had a, you know, a cut, and there was some tear as well. So I ended up of having those stitches, which were, you know, quite painful for about more than a week after.
Yeah, okay. And is this tear is extending to your back patient?
No, it didn't go to that passage. It just was like, you know, a big, yeah, it just was a big tear, really.
All right. And how's your baby? I mean, after your delivery, is your baby okay, or your baby have been admitted to the
Yeah,
maybe
so
intensive care unit?
yeah, so it's baby girl Charlotte. She's doing okay. Yeah, she's fine. There's no problems.
And did you start breastfeeding your baby?
Yes, I am breastfeeding the baby. Yeah.
Okay, that's very good. And after your delivery, is everything is fine regarding your recovery? I mean, do you have any problem with your water work? Any problem with opening your bowel?
No, I don't have any problems. It just is like, as I said, like I just feel quite a lot of pain, and it's just difficult to have any, you know, examination or having sex, and so I'm really kind of, you know, stressed now because of this all going on.
Yeah. Okay. And do you have any? What about your smears, Rebecca? Previously, are you updated with your smears?
Yeah, I have been up to date always, and they've been normal. Yeah. Yeah.
Okay. Okay. And have you having any period after your delivery?
I had because I'm doing both, like breastfeeding and the bottle feed as well. So I had one period which was about 3 weeks ago, and I bled for about 3 days. Yeah.
Okay, that's good. And do you start taking any type of contraception?
So for the time being, I want to use condoms, but actually we haven't been able to do anything because it's so painful. I just can't, you know, tolerate the penetration at all.
Yeah. And do you notice any vaginal discharge?
No, I haven't noticed any change in vaginal discharge.
Okay. So, Rebecca, do you have any medical problem before you are following with your GP?
No, doctor, I don't have any long-term health issues.
Any surgery before in your tummy or pelvis?
No, doctor.
Apart from this cut? Okay.
No.
Are you allergic to any drugs?
I'm sorry, say again, doctor.
Are you allergic to any drugs known to you?
No, no, doctor.
Okay. And are you taking any type of medicine right now?
No, doctor, I'm not taking any.
Okay. Do you smoke, Rebecca?
No, doctor, I don't smoke.
Okay. Any alcohol?
No, not drinking.
Okay. Okay. You told me that how's your partner? Is he supportive, Rebecca?
Yes, he's very supportive, but as I said, like I'm not able to, we're not able to have the sex. This all is becoming really stressful now.
Yeah, it is understandable. After this cut, did they give you any appointment with physiotherapist to do some exercise to strengthen
Yes.
the muscle down in your genitals?
Well, it's not physio appointment I had, but my doctor told me to do some exercises, which I have been doing.
Mm-hmm. And are you able to do that efficiently?
Yes, I'm trying. Yeah.
Okay. Okay. Thank you, Rebecca, for sharing this information with me. So just now, if you don't mind, I want to examine you from genitals to check if your wound is well healed. And also, I want to see to check your vagina to see if there is any infection. I will take a swab at the same moment, and also I need to see the muscle, the strength of your muscle that from down below.
Okay.
Is that okay?
Yes, doctor.
So, okay, Rebecca, from your history that you have told me and from the examination, it's showing that you have your vagina is very dry. Maybe the cause is that because you are breastfeeding your baby good manner, and that is very good. But sometimes breastfeeding it may make your vagina very dry. So
Okay.
that yeah, that may be the cause of your vagina become very dry when they touching you, and also you have difficulty to having sex.
All right. Okay.
Yeah. So for that, I will prescribe for you some local creams that it will lubricate the area,
Okay.
and it will help also you with having intercourse.
Right.
Am I clear
Doctor.
so far?
Yeah, that sounds okay. Yeah.
Okay. And regarding Rebecca, after any cut down or difficult delivery as you are having, so that we need to give you some exercise, and it is better to be done by a supervised physiotherapist, as you have tried alone, but I think you are not able to do it in a correct way.
Okay.
So yeah, if you start doing this exercise, it will help to strengthen the muscle down in your genitals. So when your muscles is strong, so you will not have this pain and that you are having with intercourse.
Okay, doctor. Yes, yes, I would like to do that really because I'm really fed up with this.
Yeah. So Rebecca, if all these things are working and you are able to have intercourse, but if you are still not able to have intercourse and you are still some local anesthetic cream that we can inject also down in your
There is lots of
yeah,
your
I'm sorry.
Yeah.
They are calling me as I'm in duty. Okay,
All right.
I'm closing. Yeah, okay. And this also, it will help to relieve the pain and numb the area down below.
Okay, right. That's okay.
So do you have any question or any concern?
No. So will I have to apply this cream always then? You know.
We can apply the cream, and also you can continue with this exercise. So this will help to strengthen your muscles down. And after a time, I think this area, when you are starting doing this exercise, and I think it will become a little dry. And some women at first months after breastfeeding, they start to have this dry vagina, but after a time everything will be corrected due to
Okay.
hormone change. Yeah.
Okay, doctor. Yes, I will
Okay.
use that then. Yeah.
Okay, so Rebecca, meanwhile, I recommend you to maintain eating healthy balanced diet, so you will not have any constipation also. And
Okay.
yeah, and also I recommend you to keep your genitals clean and dry. Okay, I mean, so that you will not have any infection. And anytime if you feel that you have any vaginal discharge, or the pain is not going well, so you can contact your GB, and also will give you appointment after 3 months. Okay.
Yes, doctor, that sounds good. Yeah.
Okay. Okay, so I will give you some written information. You can read more about this, and I will give you appointments with my consultant after 3 months from having these sessions with the physiotherapist.
Yeah.
Okay. Okay.
Okay, doctor. Thank you.
Thank you.
All
Thank
right.
you.
Okay.
I'm sorry for disturb. Really, I feel distracted
No, no
with the
problems.
calling. Okay.
At all. It's understandable. It's
Okay.
fine. Right then. Okay, this time is over. So that's fine. Good. So you have done, the important thing which needs to be included. However, I feel that there was like few more things you need to exclude. I know the scenario says the GP feels you have atrophic vaginitis. But she's only 33 years old. She has gone through the delivery recently, so hormones and everything, and she's breastfeeding. Yes, when they're breastfeeding, that can cause some dryness in the vagina and some uncomfort because of that, but that won't cause actually atrophy. Yeah, so that won't basically cause the atrophy of the vagina. So it is fine. You will still offer her lubricants, and if that doesn't work, then you can still consider some estrogen creams as well. However, it's very important that you do exclude other reasons of this superficial dyspareunia difficulty. You need to exclude vaginismus. You need to exclude any history of domestic violence or any sexual abuse in the past or recently. So these are very important as well. And anything else if that's going on. Yeah. So once you, so your start was fine to introduce and just establish the postnatal care. Well, she's 3 months, but still it's fine to ask. So you will ask, been fine, and how the baby, and are you breastfeeding or bottle feeding, contraception, have you started that or not yet? And then very important thing, she volunteered herself to say, that she can't have the sex is painful as well, and she can't have the penetration. But if you're not, this is important thing as well to ask, has you resumed your sexual activity, and can actually you do, the sexual action, can you have a penetrative sex? So if you would have gone into the details, she actually haven't had any penetrative sex since delivery till now, because she just find it very difficult and painful. And then she said it's affecting with the partner as well. So this woman does need, as soon as she says it's been affecting the partner, you can ask as well, I'm sorry to know this on, and this must be very difficult. How are you coping with that? And who is your partner? Yeah. And then when you ask the partner, then you need to ask as well that, how did you feel like, so when she says it's irritated and all that stuff, then you can just ask as well. So how is your, overall relationship with your partner? Do you feel happy and safe with them? And then you can continue to say, I need to ask you a few more questions just to, get to the, get an idea of what's going on. And then to ask about histories of, so you exclude any STIs as well. So you did ask, started from the delivery, what happened after, was there any infection in those stitches afterwards? Did they heal properly? And then particularly ask her, do you feel, also say scar is well healed, but, still sometimes it's touch. And if there is a granulation, then they can have a bit of tenderness in that as well. So you need to ask them, is there any pain in your skull? Have you, did you feel that pain is actually in that area? What exactly happens, when you say it's painful, and then she can actually explain to say whether it's the vagina muscles which contract, which will be purely vaginismus then, or basically there is some local cause for that. Yeah. So ask that question. What exactly happens, and the pain, where do you feel that pain? Is it like your muscles go very tense, your vagina muscles go very tense and close, or is there, some tenderness and pain in that area when it's being touched? Yeah, so exclude that as well. And then you will say, I will exclude that psychosexual or any previous sexual abuse question. And usually the way I ask them, and I say, so sometimes the women, if they have any, traumatic experience in the past or recently, like any sexual abuse or any trauma or injury down in that area, that can also, can get provoked after the delivery and having this, trauma in that area, because that can just bring that feeling of pain in that area again. So have you been through any of these in the past or recently? Yeah. And then she can tell you. So the details if you would have asked me, basically, I was going to tell you that I did have some injury in the vulva as a child. And I had those stitches and they were very painful, and maybe because of this all which I have, that has provoked those things as well. And this is actually a real thing. People who have any surgeries in that area or any tear in that area, and even sexual abuse, they do proper feel the physical pain when they've gone through that intimate, because she had that pain and stitches and all that stuff. The body goes back, that area of the skin and tissue goes back into that reflex. Any touch in that area basically will cause the pain. And even if she doesn't, if these episiotomies, if they're extensive and painful, that can also make them. So then you can start summarizing and say, so what happens, because you had those stitches and they were painful for some days, as you said. So what happens after that, sometimes your skin and the area actually just learn that this area shouldn't be touched, otherwise it will provoke the pain. And as a result, it can, try to go tense at the time when we try to do any examinations or even any penetrative sex. Okay, so to do that, obviously we need to tell you some therapies to try to make your genital area to learn again that it's okay to touch that area. So that's called desensitization. However, because you're breastfeeding as well, so because of those hormones, that can also cause some dryness and lack of your secretions in the vagina, which can also cause the tenderness and the pain. So to do that, so do the simple things first. So after I'm gonna, give you some emollients to use and some gels to use in that area. And some if there is some actually basically any local pain, then lidocaine is going to help, if you can say yes, there is actually the pain in certain area. Otherwise, if just is a vaginismus, that's just basically the contraction of the muscles, then the lidocaine is not going to be very helpful. In that case, we need to actually do the desensitization of the area. So then you can say that I would like you to, try to desensitize the area as well. And to do that, we can start from very simple things. So the first is, yes, I'm going to arrange your appointment with our physio. We can help you basically to tell you some exercises to make your muscles learn how to relax when you're going to have any examinations or the penetrative sex. And then for desensitization, you can start with simple things, like you can actually start to put your 1 or 2 fingers in the vagina and proceed slowly and take it deeper for deeper penetration. The benefit of doing this way will be that you will have a control. You can actually stop if it goes too painful. But if you slowly and gradually can try to actually penetrate, then you will have that, your tissue will learn that it is actually okay to have the penetration or any touch in that area. So once you get control on this, then you can increase it up to, 2 or 3 fingers. I can also provide you some dilators. They are just like finger-like, the instruments, which you can actually slowly and gradually start putting inside your vagina, and then you can increase the thickness of those dilators. And once you feel, basically, you can do it and you have the control, then you can, involve your partner as well in that, So there can be a foreplay before the sexual activity and penetrative sex. And he can do that for you. And obviously there can be some player of sexual, there can be some element of sexual player as well, and that will help obviously you and your partner as well to reestablish your sexual activity. So that these are the few things you can do, and then obviously you can help us to say. So obviously we need to examine as well then at the end, and then you will say, so at the end of this consultation, I would like to examine you as well, if that's okay with you, just to see and find, I would like to just have a look on the scar. I know your doctor has mentioned it has healed properly, but sometimes it looks it's healed properly, but when you touch that area, basically can cause some tenderness. So it's important, I feel for that as well, because if that's the case, then we need to treat that, and, depending upon how tender it is. And sometimes we treat that with some steroid creams. Or sometimes we may need to repair that area again. However, it does look unlikely in your particular circumstances. And then, so how you feel about it, then you need to ask her. And then just say, acknowledge that this is difficult, obviously having this pain and all this examination with the partner. You can say, I feel it will be helpful if you're happy, I can arrange an appointment to see one of our counselors as well. And that will really help if both of you can attend that counseling together. Because, obviously that will then remove that extra pressure on you being, not able to have the sexual activity. So after that counseling, and then obviously offer her another appointment in a couple of weeks' time. And reassure her to say that it's not uncommon. Some women can have this, problem after the delivery, and it's correctable. It goes with the time, so you will be able to resume your normal activities. Then you need to talk about the smear as well. So you did ask about the smears being normal and all that. Then you need to reassure by saying that that we can actually wait for your smear for a few more months, because your previous smears has always been normal, and there's no risk factor. And we do ask if there is any intermenstrual bleeding, postcoital bleeding. And then you can say, so once obviously you are okay to tolerate this examination and speculum examination, then we will take your smear. So I'm going to arrange your appointment in 3 to 4 months again to review and see if you're okay, or if there's anything different we need to do for you. Okay, that's all. Any questions? So the main learning point from here is, as I repeatedly say, don't prefix your mind by reading this scenario that this is that particular recall, and basically this is what it is, and I'm going to talk about this. Just stay, open, just to exclude other reasons as well. So if anything else, everything else is fine, and it's just the, that one, then you just ask, you clearly ask, is it like some pain in local area which prevent you from having, or you feel your muscles become very tense as well, to exclude vaginismus, basically. Okay, right. Any questions before I go to the next and the last session?
I need to take full history
Yeah,
here,
Dr. Sophia,
or
please.
just focused?
Focused history you need. We don't need to have any other long-term history. So just the history points which I have discussed here. So exclude that she had any infections after that, and the healing of stitches was fine, and then any previous history of trauma or injury in that area, or any sexual abuse. Yes? Yes, please.
So, Dr. Sophia, this particular case, I don't know the cause of her dyspareunia right now. We're going to speak about differential diagnosis. So, how I manage this case in real exam? Means she will direct me to one of these causes?
Yes, so, when you will ask the question, do you have any previous history of any injury or trauma in this area or that experience? If she excludes that, then you don't need to worry about it. But vaginismus still can be there because of the pain of she has from these stitches and stuff. So you will differentiate that from by asking, this question, which I said you need to ask clearly. Is there any particular area which is painful when it's being touched during sex or in the examination, or you feel that your muscles go very tense at that stage, and for that reason, basically you cannot have any penetration. All right. So if she clearly says, yes, I feel my muscles go, then you need to include desensitization and everything. But then obviously you still need to offer her some emollients to use and some lubricants to use, because of the dryness in the skin is, in the vagina can be a reason as well. But yes, she will clearly tell you
And
those answers.
yes, yeah. For example, if she disclosed that she has been abused, means I will tell her I will refer to psychosexual clinic.
Okay, so if she discloses that she actually was abused as a child or at some stage, and then because of that now she's feeling this problem again, then yes, you will arrange for the counseling. Then you can say that I'm sorry, because when, and that is understandable that when you have these tissues and these intimate examinations that can actually provoke your previous feeling of pain and everything. So if you feel okay, I think it's very important, I can arrange your appointment to see our specialist counselors. They call psychosexual counselors, to help you to overcome that bad experience on the trauma, to overcome it. Because if she has been pregnant, that means she has been able to resume her activities and stuff, have the sexual sex, then you will do that. But then there will become another very important element here. Then you will need to ask at what age actually she was sexually abused. So if she was sexually abused in adult life, then okay. If she was abused as a child, particularly below the age of 13, then we will end up saying, well, because she was abused as a child, I need to discuss with our safeguarding team as well, because in these cases we usually we need to inform these cases to the police. If she's below 13, if she was below 13 at the time of sexual abuse, so and then if she says no, she doesn't want to do that, and she has been over all that stuff, then you say, okay, we will not do this immediately. However, Rebecca, it's very important that you think about it, because the perpetrator might just be continuing to do that, and there might be many other children who are still at risk of getting abused by that particular person. So your identity can be kept confidential. So we don't need to, that will be respected. You don't need to put that as a case against him if you don't want to. But giving us that information so that the police or the appropriate services actually can approach and investigate him in an anonymous, keeping your ID anonymous is extremely important, because he still might be continuing that criminal behavior. Okay. So yes, if anybody exclude any history of sexual abuse in the past, it's very important you do ask at what age that happened. Did she do anything about it? Would she like to do anything about it? But if it was adult and something like that, then it's fine. But if that happened being a child, even up to the age of 17, it's important to encourage them to say. But if she is particularly below 13, then we need to say, that I'm going to discuss with the team, and then I will let you know, because we may still need to, inform the police and take some steps in the wide interest of safety of the children in the community. Okay. Any other question?
So if it's not the sexual abuse, or if the case is not like that, still there is no, we don't have to involve the psychosexual counselor in just postpartum dyspareunia. We don't know about the cause.
Right. So when we said we are going to arrange the counseling, that's what that counseling is. We don't clearly sometimes use the word to say psychosexual counseling, because sometimes these patients, then they get upset by thinking, no, it's not my brain and it's not my mind that I'm playing or something like that. There's nothing wrong with me. So that basically is psychosexual counseling we are arranging.
And what about, ma'am, cognitive behavior, just talking therapy? In this case, we have to say that.
That that will, you can go into more detail if there is a clearly she take any element, you know, this sexual abuse in the past or some trauma in the past, and because of that she is, then you can start by saying, you know, that this will be our first to go for this counseling. And then if that did not help, and if you still have the time actually to continue, then you can say if that didn't help, then obviously we have more specialist, counseling therapies available. They're called cognitive behavior therapy, and in simple words, talking therapy. And you know, that can help you basically to come out of those post-traumatic effects and thoughts, and help you to actually resume your normal sexual life. Okay.
Okay.
So cognitive behavior CBT is not required if she just basically has become that pain sensitive because of just simply, you know, the episiotomy and that all stuff. Then the counseling is fine to start with. And
Ma'am,
then
one more question in the.
you need to
Sorry.
ask. Let's just finish with this first. So you need to ask as well, because she's a referral from GP. So you need to ask as well, will you be okay for me to write back to your GP about our management plan? Yes, go on.
Ma'am, in the similar question whether episiotomy was not properly healed, so in that we'll say we'll advise you to massage the area for the proper circulation,
Yeah.
and then how do we say about this modified fentanyl operation thing? How do you address that, and for
Okay.
what's the referral for that?
Okay, so if that turns to be the scar was hypertrophied and thickened scar, then you need to obviously ask the same question as well before, that is, that your scar basically painful as well, because it may be thickened but there's not tender. Then that's not the immediate reason, but you still will talk about what further management can be offered if she's concerned and she wanted to be corrected for cosmetic reasons. But if it is painful, she says it is painful, then you need to say first you need to explain what hyper, why this is a thickening. You can say in some people when you can say when the wound heals, then you need to, that causes some growth of the new tissue in that area. Some people actually have a very strong response to that healing, and their scar can become quite thickened. So because of that, they can feel a pain that can become painful as well. So there are a few treatments, simple treatments first to start with. So what you need to do then talk about, like, use some certain oil or emollients to do a massage in that area, because that will increase the blood circulation and will help that, scarring to become better and heal in a proper way. So that's the immediate step to start with. Then you can say, and if it's painful, then you can, use this. I'm going to give you this numbing cream, local anesthetic cream to apply on that. So that meanwhile, you can resume your, the sexual activity, and if any examination is required. So that will be second thing. And the third thing you need to say, so regarding the treatment of that scar, I would like to examine this after this discussion. And then we will see if it's quite, prominent. Then there are two different options available for the treatment. One is in some scars, thickened scars do respond very well to the steroid treatment. So depending upon the size, how much thickened it is, it can be treated either with the local application of a strong steroid cream, or sometimes there can be some injection given inside the tissue of the steroid. And that can help basically to resolve and thin that scar back to the normal. If that's, if that's something which didn't work, or you didn't want it to go for that, then obviously this can be repaired again, in which obviously we can, cut this thickened area and then try to suture it back. However, in that particular, if you choose to go for that, you need to be aware that if your body actually have that tendency to heal with overactive response, then after that repair, you may still end up of having a thickened scar, right? So then you will offer her to say, okay, so, so let's start with these things to start with first, and then I will examine you, and then we will see how the things go. And even to her as well, offer her physio as well, because all those exercises and stuff obviously does help to improve the circulation as well, which can help basically with the scar healing. Okay. But in that case, then if you have excluded the element when you ask, do you feel your muscles go strongly, tense and all that, then we see that will save your time from that desensitization stuff, which you can put into the treatment of. So these basically questions you need to ask and then start talking accordingly. Lubricants needs to be offered in any case anyway. And then try to do, they try to slowly and gradually apply that cream and then slowly and gradually try to resume your sexual health, the sexual activity. Okay, any other question?
Thank you, ma'am.
Right, okay, so Bridget can't do. So I think everybody has done now from Saturday and Sunday group. I have put your scenario, Sama, you sent for management, another labor ward. So I will include that in our next session of delivery management, because we're going to do a couple of other labor boards as well. So I will include that one. And meanwhile, obviously, if there are any other scenarios you all feel up to the modules we have done till so far, please feel free to post them and post me as maximum details of the scenario as possible, like what the role players were saying and what the examiners were saying in the exam as well. Okay. Any final question before I close the session for today?
Yes, Dr. Safia. So what? So our all modules there end up if we say the teaching we have done in the Friday, the clinical governance.
No, you guys Saturday and Sunday group still needs to do delivery management module.
All right, on the next Saturday.
Yeah,
The coming Saturday, Sunday. All right.
that's right.
And what about, doctor, do you decided that you will have an extra session for structured discussion?
Yeah, so those ones we have decided the dates to be done on Saturday the 14th or 15th, Sunday the 15th. I will tell you about the date.
Okay, thank you, ma'am.
Exact date. Okay. And then there will be one mock I will arrange as well. Just before the exam, I think the last weekend of April or the weekend before. So you all can, I will post so let me just see actually, we can send, then you can all actually do some consensus to tell me when you would like that mock being done. Let's have a look. So your exam is starting from 11th of May. So there will be one weekend on 9th and 10th of May, and one will be on 2nd and 3rd of May. I think 2nd and 3rd of May, one day of these 2 days will be better. Because in the last 1 week, some of you might be traveling and going, and just before the exam, I don't like doing the mock or anything, because then you feel so stressed if you haven't done very well in that, and that compromises your confidence during the exam. So 2nd or 3rd of May, you all can tell me in the comment group what day would you like to do that. Okay. That's all for this one. So this Sunday, these 3-4 stations, obviously they were extra, so I will post these to everybody. And the Saturday and Sunday group will actually receive Saturday and Sunday both recordings. Okay, goodbye now.